I'm going to put myself over here. And again, you guys are going through clothing, which gives me a little angina. Y'all know what angina is? Chest pain. Okay? Because I'm allowing you to practice in a way that will lessen your chances of being successful. But the virus is making me do things that I don't really want to do. So please, please, pretty please, when you're practicing at home, make sure you can see the landmarks as well as feel them. Okay? All right, Connor. So I'm going to put my hands on his rib cage. And I'm going to slide down. And then in between, can you see how I'm putting my hands on a shelf? Putting my hands on a shelf. Okay? So I got to start on the rib cage. And I'm going to slide inward. Okay, I'm still on his rib cage. How do I know? What do you think the rib cage feels? Hard. Okay? And then all of a sudden, I get into a space. So now I'm in the space between his rib cage and his pelvis. And I'm going to sink my hands down. And now I feel like I'm on his iliac crest. Left side, okay? Come back, sink in, right side, okay? And again, I might be examining Connor's iliac crest for position. Is one higher than the other? Is one sorer than the other? Maybe he's a low back pain patient and I need to examine his pelvis, okay? And then I'm going to bring my fingers anteriorly and inferiorly until I feel two knobs, okay? You should be able to feel the anterior superior iliac spine even on the largest person because there's no soft tissue covering other than the skin. And there is his left anterior superior iliac spine, and now over here is his right. Okay, we good? All right, and now we need to go to the greater trochanter. Okay, oh, pubic bone. Connor, can you feel your pubic bone for me?
Right here.
Yeah. Okay, that's what I do with a patient. Go ahead and do that again for me.
Right
Okay.
here.
And so now I'm going to feel, and there's his left pubic bone, his right, and the pubic symphysis is going to be right in between my fingers. Okay? So you don't have to do this, okay? But you at least need to be able to do it on the skeleton. Okay. So now we go to the greater trochanter, which is on the proximal lateral end of the femur. And I'm going to actually have you bend your knee up. Okay?
This one?
Yep, sure. And again, I'd be standing over there, but I'd occlude your view. So I'm going to slide down. You mind if we do that?
Sure.
You okay? Yeah?
Yeah.
All right. So here's his femur. And I think I'm on the epicondyles, but I'm not sure. Is there anything I could do to make sure? Okay. So Connor, can you just straighten your knee? Good. You don't have to even do it a lot, just a little bit. And then bend it again. And straighten it. Good. And so the lateral epicondyle right here sits perfectly vertically below the greater trochanter. So I'm going to use the lateral epicondyle and slide. What am I looking for? What do you think I'm looking for?
Bump.
A bump, okay? And I think I'm on it, but I don't know. So now I'm going to ask Connor to straighten out his knee all the way. And again, I think I'm on it. I actually think I'm a little too anterior. Right there. Is that okay?
Mm-hmm.
You're not sensitive, are you? No?
No.
And now I'm going to ask Connor to roll his leg inward. No, you don't have to roll your body, just your leg. Okay? So just in and out. And now I'm going to make an adjustment. Now I'm on it. Okay? So what I just asked Connor to do If my hand is the greater trochanter and I'm palpating, I'm asking him to do this and this, and I'm going to feel it underneath my fingers. Make sense? Okay? I can see his kneecap, but I want to feel his kneecap. And I'm not putting a lot of pressure over the top of it. I'm feeling around it. Okay? Immediately inferior, I think I'm on the tibial tuberosity, but go ahead and bend your knee again. And I should be moving with the tibia. Okay? I can feel all the way down. That's the crest or shaft of the tibia. Okay? We got the medial and lateral malleolus, and I can make sure I'm on. What can I ask him to do? Step on the gas pedal and off. Yep, on, off. Now I'm going to stay on the lateral malleolus. Oops, you know what? Move that down, sorry. Perfect. Good. Let's rewind. Back to the patella, tibial tuberosity, down the shaft, over to the medial and lateral malleolus, step on and off the gas pedal. Now I'm going to slide laterally and in a superior direction. Some people, you can see their fibular head. Connor has little fibular heads. Okay? And I'm right there. Now bend your knee for me. And again, I should be moving because the tibia and fibula is moving on the femur. Okay? And then back down. Okay? Now, bend this knee and get it out of the way. Over to this side. Okay? And here's the calcaneus. So I'm on the posterior surface, the plantar surface, the medial and lateral surface. And again, if he moves his ankle, go ahead and on and off the gas pedal. I should be moving. Okay? If I'm on the medial and lateral malleolus, on and off the gas pedal, go ahead, step on and off the gas pedal. I shouldn't be moving. Okay? Quickly flip over onto your tummy. Do you want a pillow for underneath your tummy?
No.
Okay. And I'm going to just show you, slide down a little bit. Perfect, good. And we'll just go couple more. Okay. Iliac crest, same way, whether you're going from the front or the back. Okay. Rib cage. In between, I'm still on rib cage. Now I'm in between, under the rib cage, and I feel like I'm on the iliac crest, right and left. I'm going to go posterior, don't come off the body. Notice, Patrick, I'm keeping consistent with my fingers. I'm going to feel two rounded knobs, projections. Those are the posterior, superior iliac spine. Spine is really a projection. And then in between is the sacrum. Okay? And if I follow the sacrum on down, anybody know what bone I end up with, not Doreen? Anybody know what the terminal end of the spine is?
The coccyx.
Coccyx. Okay, that's a good one to learn how to spell. All right? Now the ischial tuberosity, if I come like this, I may not feel it. I want to come like this and get right up and under it. Those are your sits bones, and there's his ischial tuberosity. Okay? I can use the same technique to find the greater trochanter shaft. Think I'm on the epicondyles. Now again, there's a crease, so you want to be superior to that crease. If I go down here, and I'm calling these epicondyles, I'm on tibia and fibula. Okay? So use your eyes. Connor, don't bend too much, just a few degrees. Bend your knee, and then back down. So now I'm confirming. I'm gonna stay on the lateral. I'm gonna slide straight vertically superior, somewhere in here. I think I'm on his greater trochanter. How will I confirm? He's gonna roll his leg, just your, no, honey, just your leg, okay? Let me show you, okay? Turn your foot in, and then turn your foot out. That's it. Turn your foot in, and I'm not on it, okay? But if I go just here, now I'm on it, okay? So I thought I was on it, and I would have lied. Now I'm on it. Connor, can you feel the difference on it versus on top of it?
Mm-hmm.
Yeah, okay? Don't hurry, take a couple minutes. Medial and lateral malleolus. How can I make sure I'm on? Gas pedal. And then in between, now I'm on the calcaneus or heel bone. Plantar surface, lateral surface, medial surface. Can't really get to the superior surface or the anterior surface. All right, go play. Thank you, sir.
No.